everyone. My name is Katerina. I am a certified child life specialist, and I'm also a graduate student at Missouri State University in my final semester, finishing up my evidence-based practice. This is my EBP presentation. My topic of choice was the impact of preparation on school-age patients undergoing surgery. So like I said, my topic of choice was analyzing school-age patients and surgery. So I posed my clinical question, my PICO question, as among school-age children receiving surgery, does the implementation of surgery preparation compared with no preparation reduce anxiety? The reason I chose this topic, I feel like there's many different reasons, but early on into my studies as a child life student, I was very interested in child life in the OR to begin with. I just thought it was a really cool area. Preparation was something that really drew me in about child life. It's still to this day my favorite thing about child life, and something that I get to do all the time still. So as a early on student, I knew that my topic for my EBP was going to be something about preparation, probably the OR. And then this kind of piqued my interest during internship too. While I did not have a rotation in the OR, I did get to do lots of OR preps in the emergency department and on the general pediatrics unit. I did get to pick a shadow day in the OR, and I really enjoyed my time there. It was really cool just to get to see all the different questions that come up from kids, and all the different reactions and how, our preparation is so valuable. I also wanted to look at the impacts of preparation on anxiety, because, there are many reasons we do provide preparation as child life specialists, but, reduction in anxiety is a big one. And I think a component that a lot of other professions would perceive as valuable as well. I also wanted to look at the different forms of preparation that could be presented to patients and their families, because it's not just telling them a list of things that'll happen. We can do it in a lot of different ways. So I began my research for my evidence-based practice in fall of 2022. I took a break for internship and the summer, and then began it again this fall, in fall of 2023. So I started my search back in the last fall. So the date of my last search was November 26, 2022. During these searches, I limited them to research articles in English. I used the Missouri State University online library to find all mine. I had no limits. I like the date ranges that I used was from 1999 to present day, and still more research continues to come out, actually, even after I made my evidence-based practice and completed it last week. More research continues to come out, which is just amazing, and I hope that someone else will be able to incorporate those studies into their evidence-based practice. Some search terms that I found super helpful for when I was looking for articles that met my criteria were I used the words school-age children, pediatric patients, surgery, preparation, anesthesia, child life specialist, tour, picture book, and intervention. Some criteria that I also used during my search as to what I felt was applicable to my PICO question, my clinical question, I cut it down to school-age children who underwent surgery. I excluded any patients that were younger than 6 years old and older than 12 years old, and have also previously experienced surgery, due to the fact that I don't know what that experience was like for them. Neither did those researchers. Maybe they did have preparation for that previous surgery, maybe they didn't. And now there is some trauma from that experience that could skew the research findings of the study that was currently happening. And my target population was school-age children. So some definitions that I felt were important to explain in terms of my evidence-based practice was what the word intervention meant. An intervention is implementing a variable with the goal of supporting children and families in their surgical experience. And that's what the term means in the context of my evidence-based practice. I also felt it was important to explain preparation, which is an intervention which includes developmentally and age-appropriate explanations of procedures to promote understanding. Preparation can be provided in the form of pictures, videos, real materials, and tours. And I also felt it was important to explain what pre-medication means. A lot of times, excuse me, I feel like the word pre-med is thrown around and people are like, what does that mean? But pre-medication is a full word, a medication taken before a procedure or surgery to lower anxiety levels. Sometimes, and what I found too, that I'll get to later, is that pre-medication was offered also with interventions or compared to. Recommendations that I gathered from my evidence-based practice were very interesting, things that I had suspected based on my own experiences, and just other things that I found were common themes in research articles that I was finding. The first one being that school-age patients who have no previous history of surgery or procedure requiring anesthesia are provided with psychological preparation prior to surgery to decrease anxiety levels. Pretty much meaning that if there is a patient, at least in the school age range, that they should most definitely receive some form of preparation. And I will get into the different forms later to help alleviate anxiety prior to surgery. My second recommendation was that a parent or caregiver can be present with school-age patients during the intervention and or their day of surgery to further aid in reduction of anxiety levels. There's a few studies that I found that specifically spoke to anesthesia induction, where this was most helpful to alleviate anxiety in school-age patients, and also found to be helpful in reducing anxiety in parents. My third recommendation is that it is recommended that school-age children pair preparation interventions with pre-medication to aid in reduction of anxiety levels. A lot of studies I found also did pair preparation and a pre-med to reduce anxiety levels in children, and they were found when they compared just a pre-med, just preparation, or pre-med and preparation, that the pre-med and preparation were the most effective than, isolating one of the two and just doing that. So it was found to be most effective when paired. This was my PICO table that I compiled. I wanted to stick this in here just to show that there are a lot of studies that went into this research. I had even more columns, and I was able to cut those out to kind of limit to what was relevant to my study. So I looked at anxiety being reduced or having no change. Luckily, I did not find any studies where anxiety was increased. Other outcomes that I found were a decrease in parental anxiety and an increase in compliance for the patients. There was various preparation methods used. There was medical play, photo books, video modeling, VR, and tours provided. So in my research findings, the most effective preparation methods to decrease anxiety, as shown by the studies listed below, were medical play, video modeling, photo books, and tours. So medical play as preparation in these studies was most commonly with an anesthesia mask, a pulse oximeter, blood pressure cuff, stethoscope, syringe, common things that children would interact with the day of surgery. And medical play was shown to reduce anxiety levels and increase compliance. Medical play was also paired with a pre-surgical tour in the Brewer et al. Study in 2006. This was also conducted by a certified child life specialist, and it was shown to reduce anxiety compared to patients who had no preparation or pre-surgical tour intervention. Speaking of tours as surgery preparation provide adequate expectations for patients and families. They educate on the function and purpose of various steps leading up to surgery. They provide a familiarity with the environment, also provides a mastery. There's an opportunity for questions when tours are provided, and they also help to alleviate misconceptions for patients and families. And tours are another way that families and caregivers can be involved in their child's care to really promote a sense of patient and family-centered care. There's a study, Karimi et al. 2014, that found that pairing a tour with a parental parents, anxiety levels were found to decrease for school-age children and also for their parents. Photo books have also been found to be a very helpful form of preparation for patients and families. Photo books are typically the way that I prepare my patients and families for surgery. Typically, the photo books in these studies are the waiting room, the exam room, medical staff, equipment, the operating room, and recovery areas. School-age children who read and looked through a photo book the morning of their surgery reported lower anxiety levels than compared to the children than compared to the reported anxiety levels the night prior to the surgery. So I found the timing quite interesting. When it was the morning of, they knew what to expect, and compared to the night before when they had no idea, no preparation. This other study, Sadeghi et al. 2020, compared photo book preparation the night before surgery with the morning of surgery, and they found that anxiety levels were lower in school-age children who also received photo book preparation the morning of surgery. Further research is needed to analyze the timing of photo book preparation. Not many studies touched on this specificity. I believe that this would be something really helpful. As child life specialists, we know the timing and when to provide information to patients and families as to when we feel it will be most beneficial for them. But many studies did not touch on this. So I think for further research, that would be very important. Video modeling was also another beneficial method of surgery preparation. Video modeling showed patients and families a typical routine leading up to surgery, including vitals, pre-surgical care, areas to expect, what everything looks like, and equipment. Video modeling, as discussed in Pinto and Hollingsworth 1989, as psychological preparation, has also been shown to provide cost-saving services and decrease the need for pre-medication. So these cost-saving services are decreasing the cost for pre-medication for patients and families. Videos have been shown, in this study to be effective and not need pre-med. While there are other studies I've previously mentioned that recommend preparation and a pre-med together, some are showing that preparation is good enough. Photo books are often paired with other interventions, such as videos, to help decrease anxiety levels more in pediatric patients, in Fernandez et al. 2014. So this study paired videos and photos together to decrease anxiety levels that were found effective, showing similar things. And all these studies below also spoke to the effectiveness of video modeling. And these are all my references that I used throughout my evidence-based practice. There are many. Thank you everyone for watching. I'm looking forward to hearing about everyone else's findings, and have a great rest of your semester.